Hi everyone, welcome back to the episode of Ask Dr. Nick. My name is Dr. Nick Schmidlkoffer and I work for the Neurologic Wellness Institute. And today's question is, what is the best approach for treating long COVID? And I know this is a hot topic right now because there are a lot of people over the last couple of years that are suffering from effects, long-term effects after having a COVID-19 infection. And so I want to discuss a paper that is very recent in January of 2023, discussing the possible mechanisms that are contributing to long COVID symptoms and maybe how we can approach to diagnosing that and then treating long COVID most effectively. Because everybody who gets COVID-19 responds differently, whether they recover fast, slow, have a serious illness or a mild illness. And then at the same time, if they get long COVID symptoms or basically symptoms that are following the COVID-19 infection for a long time. So we're going to discuss this paper. At the end, I'll discuss what I think the most beneficial approach or the best approach is, but we'll first discuss what the paper finds and then go on to that. So this paper is from Nature Reviews in Microbiology. It's, again, I told you it was from January 2023. It says that at the end of the paper, but it does not say it on the front page. So long COVID, the major findings, mechanisms, and recommendations. So I do really like this paper. It's a very good review. And so basically, if we just look at the abstract, long COVID is an often debilitating illness that occurs in at least 10% of those with SARS-CoV-2 infections. So at least 10%, but we don't know that exact number. There are more than 200 symptoms that have been identified with the impacts of multiple organ systems. So that's important because a lot of people in the beginning thought that long COVID only affected, or COVID in general, only affected the lungs and breathing or the respiratory system. But rather there are multiple organ systems that are affected, which we'll discuss here in a sec. At least 65 million individuals worldwide have estimated to have long COVID. Obviously, cases are increasing daily. There are biomedical research that has made substantial progress in the last couple of years. So similarities with other viral onset illnesses, such as myalgic encephalomyelitis or chronic fatigue syndrome, and postural orthostatic tachycardia syndrome, have laid the groundwork for research in the field. Basically, before COVID was a thing, there were a lot of issues with post-viral fatigue or viral onset. Basically, people would get viruses and then it would cause myalgic encephalomyelitis or chronic fatigue syndrome. This is basically a syndrome that is initiated by one factor and that leads to this chronic fatigue, lack of endurance, post-exertional fatigue. So basically, those people can't do any kind of exercise without fatigue. Some people become bedridden. Others can't maintain full-time jobs. They have to be part-time. And so this is something that we're going to discuss in this paper, as well as POTS, or postural orthostatic tachycardia syndrome, which is a form of dysautonomia. Basically, the autonomic nervous system is not able to shunt blood flow to different areas of the body well enough, especially the brain. That leads to an increased heart rate and maybe possibly chest pain when going from laying down to standing. It leads to fatigue, headaches, and a variety of other issues. And so these two illnesses have kind of helped break through, help improve the research going forward with long COVID. So other studies other parts of this paper look at long COVID in children, the impact of vaccinations, whether they help or not, and other key findings critical to long COVID, like current diagnostic and treatment options, so on and so forth. So let's first go to the first picture. All right, so hopefully I don't cover this with my head. And so this picture is kind of showing all of the possible symptoms to what the pathology could be causing in long COVID. Again, it's a multi-system organ issue. Or multi-organ issue. So for instance, the heart, cardiac impairment, myocardial inflammation, POTS, all heart related, can lead to chest pains, palpitations in long COVID. Some people don't have heart issues with long COVID, some people do, right? The lungs, abnormal gas exchange can lead to cough, long COVID cough, and dyspnea, or basically difficulty breathing. The immune system. So this is something that there are no real symptoms related to it, but it can cause a variety of other things throughout the organ systems in our body. And so autoimmunity. Basically, if the immune system gets overactive to the virus, lead to autoimmunity. Autoimmunity can lead to a variety of symptoms that are related to the heart, the lungs, the nervous system. MCAS is it is a histamine issue, and specifically termed mast cell activation syndrome. So basically, mast cells are releasing histamine into the body, and this histamine can cause more inflammation. The pancreas can lead to diabetes and pancreas injury. Gastrointestinal tract, so gut dysbiosis, basically poor microbiome health, possibly viral persistence and viral reservoir. So basically, the virus like sits and stays in the gut rather than it being cleared out by the immune system. This can lead to abdominal pain, nausea, possibly diarrhea or constipation. The nervous system. So the nervous system has actually a big box here. So problems with the nervous system cause cognitive impairment, fatigue, disordered sleep, memory loss, and tinnitus or ringing in the ears. These can be all due to dysautonomia, like POTS, poor autonomic nervous system function, the myalgic encephalitis or chronic fatigue syndrome, where that virus causes this long-term inflammation or chronic inflammation in the brain, neuroinflammation, reduced cerebral blood flow, which is informed in that dysautonomia, and small fiber neuropathy. Basically, the small nerves become damaged and inflamed, and therefore there are poor signaling involved with the autonomic nervous system. Kidney, spleen, liver, organ injury. Okay, this is another big one, blood vessels. So there has been known that in long COVID, the spike protein that is around the virus itself can produce, or the virus itself and what's produced in the mRNA vaccines can produce microclots. And so this can be coagulopathy, where it's coagulation, these microclots, deep vein thrombosis, which is more in the veins, clotting, endothelial dysfunction, so the cell that surrounds the blood vessels causing dysfunction there, microangiopathy, microclots, pulmonary embolism, obviously that's more clots in the lungs, and stroke, clots in the brain. So problems with the blood vessels can cause mainly fatigue, among many other things. And then lastly, reproductive system, like reduced sperm count has been seen, erectile dysfunction, increased severity of premenstrual symptoms. Obviously, premenstrual is not an irregular menstruation, are more female related. So what would it be causing here? Basically, possibly microclots and organ damage for the ovaries, fallopian tubes, uterus. Okay. So I know that's kind of a lot there. It can affect, long COVID can affect many things, which means we can't just treat one thing. We need to find what is the best treatment. Okay. Before we move on to the next picture, I just want to mention here that long COVID has been highly associated with dysautonomia and myalgic encephalitis or chronic fatigue syndrome. So this is just something to think about. Okay, so let's go to the mechanisms at which can be causing long COVID. Okay, so again, hypothesized mechanisms of long COVID pathogenesis. So the first one, the first box way on the left, is immune dysregulation. The immune dysregulation can be, it can cause with or without reactivation of underlying pathogens. So everybody in the world, as we go throughout life, we get these different infections, whether they are herpes infections, they are EBV, which causes mono, or Epstein-Barr virus, which causes mono. This is a herpes virus 6. Okay, they cause infections, and these viruses like to kind of sit around in our cells, and the immune system is doing well to basically keep them inactive. But after getting a COVID infection, what can happen is they can be reactivated, and therefore the immune system isn't able to keep them in control, and then that reactivation can just cause more of a higher viral load and more issues, causing this immune dysregulation and persistent infection of either COVID itself or of this reactivated infection. So that's where immune support is really necessary for this. Okay, the next possibility is microbiota dysbiosis. Basically, our gut microbiome can be impacted by SARS-CoV-2. And if we have a dysregulated microbiome, that leads to poor gut health. Poor gut health leads to poor system health, which leads to chronic inflammation. The next one, autoimmunity and immune priming. So autoimmunity and primed immune cells can form molecular mimicry. Okay, so what does this exactly mean? Is that the immune system with all the antibodies and the immune cells that are trying to fight the COVID-19 infection can actually start to make autoantibodies against our own cells. This can be first caused by or initiated with food sensitivities and gut inflammation, but then as the antibodies are produced to our own cells, it can attack different areas in our body. So we know that SARS-CoV-2 attacks to ACE receptors. ACE receptors in the lungs, in the heart, there are other areas, but ACE2 specifically deals with hypertension or high blood pressure or blood pressure control. And so if we're making antibodies to ACE2, that's going to affect lung health, heart health, all those things. We generally improve autoimmunity with proper diet, decreasing food sensitivities, and obviously trying to remove the triggers of stress and inflammation that's provoking more autoimmune signaling. The next one is blood clotting and endothelial abnormalities. So here's a blood vessel. The endothelium is the lining cells on the outside, while the red blood cells are the inside. That's what's carrying oxygen. So there's microvascular blood clotting a lot of times with this long COVID because like I said, the spike protein on the COVID molecule, or what's produced from the vaccine, can cause basically clumping or coagulation of red blood cells, and therefore these small little arteries and arterioles that are going to your hands, your feet, your brain can become affected. Lastly, dysfunctional neurological signaling. So basically dysfunctional neurological signaling in the brainstem or the vagus nerve. I've done videos on this in the past, that the brainstem, specifically right here, that sits between the spinal cord and the big brain, is highly important, greatly important for vagus nerve function, for autonomic nervous system function. And so if there is inflammation or problems with that area of the brain, many times there is with long COVID, we know there's a lot of neurological damage that can occur either due to the blood clotting mechanisms or just direct damage to those areas. Then that can lead to this dysfunctional signaling, that can lead to dysautonomia, that can lead to poor sleep. Poor sleep can be making things worse with like that ME or CFS syndrome. Okay, so that is the gist of the paper. They do talk about what we should be looking for. So basically different diagnostic tools, imaging to detect microclots, maybe corneal microscopy, so in the eye looking for small fiber neuropathy, new fragmentation of the QRS complex, so that's with an EKG or an electrocardiogram looking at the heart, maybe MRI to detect pulmonary gas exchange abnormalities. So a lot of different diagnostic tools that they suggest. Then when it comes to effective treatments, they're maybe saying that we should look at the many strategies that are used with ME/CFS, which are like pacing, symptomatic pharmacological treatment, maybe beta blockers for POTS or the high heart rate, low-dose naltrexone for neuroinflammation, non-pharmacological options for POTS like decreasing or increasing salt intake, more cognitive pacing for cognitive dysfunction, elimination diets to get away food sensitivities, but then good appropriate diets for the gastrointestinal symptoms. There has been benefits shown with apheresis. Apheresis is basically taking out the blood and cleaning it before putting it back in to your body. That can help remove microclots. Maybe coenzyme Q10, D-ribose are some supplements that can be used. Exercise might be harmful, especially if those patients have the ME/CFS, so we have to be careful with that. Some people respond very well to exercise, on the other hand. And some patients have even responded well to stellate ganglion blocks, basically blocking the sympathetic or the fight or flight nervous system by blocking a specific ganglion, a specific bundle of brain cells, or I should say nerve cells that are at the top of the neck there. Okay, so those are what the article says. Now, my recommendations, real quick, that are a little bit different, or just maybe general. I think that everybody should get a good functional medicine evaluation, basically looking at a lot of blood work that may look at insulin resistance and metabolic dysfunction, blood work that looks at autoimmunity or chronic inflammation, that may be looking at different cytokines, which are the immune modulators. Then definitely maybe a stool test looking at microbiome dysbiosis. That would be more important if people are having gut issues or gut symptoms, but in general this can also show systemic inflammation, so again, very important there. Speaking of back to the blood work, we can look at reactivation of chronic infections like EBV, the autoimmune priming. So what we can do testing wise there is possibly food sensitivity testing, or just do an elimination diet and try to cut out a lot of the processed foods. We can look at different blood clotting issues by doing like alpha-2 or antiplasmin. We can do D-dimer tests. We can do a lot of other tests that are looking at clotting and microvascular health. That's involving the blood tests for the metabolic syndrome. And then for dysfunctional neurological signaling, that's where what we do here at our office, which is looking more at brain health. We're looking at eye movement. We're doing a vitals test, basically looking at the ability for the heart to pump blood up to the brain when laying down, when sitting, when standing, and checking blood pressure, of course, in those areas. We may do a balance test and doing a full neurological exam, including cranial nerve function, which is looking specifically at that brainstem. So if we can identify which areas are contributing, which of the 5, then in long COVID, then we can properly find out which mechanism is driving the bus, which mechanism is the most predominant that we need to attack first. And then by attacking that first, we can slowly work on the other ones as well. Or you may attack the one that is going to help with symptom management before you attack the main driver. So that is my recommendation. That may include a variety of treatment options. It might include red light therapy for decreasing inflammation. It might include hyperbaric oxygen therapy for improving oxygenation to cells, increasing angiogenesis, decreasing inflammation. It's definitely going to involve dietary advice, whether that is staying away from processed foods, eating more protein, and getting more fat-soluble vitamins and minerals that are going to improve the immune system, but also staying away from foods that might be causing autoimmunity. And that might be difficult to find. That's where an elimination diet might be beneficial. It might include supplements, whether that is fish oil for brain health, creatine for brain health, and it might be probiotics. It might be specific antimicrobials. You might have to go to a herbal antimicrobials, or you might have to find a medical doctor that can prescribe antimicrobials for decreasing viral infections or reactivated infections, especially in the gut. You may need pharmacological therapy for POTS, so like beta blockers, that low dose naltrexone for inflammation. So there's a variety of things we can look at. And a lot of times when we do therapy in our office for POTS and dysautonomia, people can improve. Some people don't improve because they have other mechanisms that are involved that also need to be addressed. So this is, if we come back here, this is my approach to long COVID. I think that we need to find out which mechanisms are the most important to attack, and then to start addressing treatment options or finding treatment options for those effects. And if we can do that, we can generally have pretty good success with people that are struggling with long COVID. So I hope you had, I hope this was very informative. I hope that you can share this to many people or others, family members, friends that are suffering from long COVID, so that they can find the best doctor or doctors, as this is probably a multidisciplinary approach, to find out which mechanisms are most at play. If you have any questions or comments, please leave them below. If you have any suggestions for future topics, I would love to hear them. Thanks again, and have a great day. Stay healthy.